when it comes to stroke, we broadly classify it into ischemic strokes and hemorrhagic stroke. So ischemic stroke is one where one of the blood vessels supplying the brain is blocked. So whatever area of the brain supplied by the blood vessel does not get the blood supply. So that part of the brain gets damaged and that produces a stroke. And the second one is the hemorrhagic stroke, where one of the blood vessels bursts inside the brain, leading to bleeding inside the brain. So roughly we can say that around 80 to 85% of strokes are ischemic strokes, around 15% are hemorrhagic strokes. So the risk factors for hemorrhagic strokes mainly is hypertension and some vascular malformations. Whereas for ischemic stroke, all the other risk factors hold true. So the main difference between these two strokes are that in terms of symptoms, both produce similar symptoms. But since hemorrhage happens into the brain, bleeding into the brain increases the pressure within the brain. So in addition to the routine symptoms, they also have headache, vomiting, and drowsiness as part of the stroke symptoms. So now coming to the ischemic stroke, again, the ischemic stroke, as I said, it is due to a block in the blood supply to a particular blood vessel. So this could be either due to a thrombus formation in that particular vessel, what is called as a thrombotic stroke, where some changes happen in the blood vessel, some tearing of the blood vessel wall, and then there is some clotting happens locally and the vessel gets blocked. The second one is there is a clot which is formed somewhere else, but it travels through the circulation and goes and blocks the vessel. So typically this is called an embolic stroke. So the ischemic stroke, we divide it into thrombotic and embolic. Typically this embolic stroke happens in patients with severe heart-related diseases. Either they have arrhythmias of the heart, like fibrillation of the heart, or it may be due to a severe problem in the contraction of the heart. So the heart doesn't contract properly, blood stays in the heart and produces some clot inside the heart, which breaks up and then goes into the circulation and blocks one of the vessels in the brain. So that is embolic stroke.